Awesome.
A very good afternoon, everyone. And on behalf of CII's India at 100 Foundation, a big thank you to all our esteemed panelists, to our moderator, Sumit, and to everyone joining to listen in into this very special session on digitalization, the journey towards an inclusive India at 100. As you may be aware, India at 100 Foundation is a CIA initiative that's working towards the vision of an inclusively developed nation by 2047. Today, it's my pleasure to introduce Mr. Sumit Dayal, CEO of Give, who joins us today as the moderator. Sumit brings with him deep expertise in the development sector strategy, donor partnerships, and sector policy engagement. At Give, he leads the organization's mission to promote effective and transparent giving, helping individuals and institutions contribute meaningfully to causes that they care about. He's a passionate advocate for responsible philanthropy and inclusive development. We're truly honored to have him join us today. And of course, a stellar panel that we have here that Sumit will introduce to us. So I'll hand over to Sumit. Please take over. Thank you.
Thank you, Aparna. And welcome, everyone. I think it's a wonderful topic when we're talking about digitalization and what that means in an inclusive India. Two keywords in there: digitalization, we all understand it, we are living it every day. Inclusion, we all think we understand it, but all of us have a different opinion on what that means. But I think what we can all agree on is that 100 is a big number. It's a milestone for anybody, any kind of organization, any kind of individual. 100 is a very, very important number. And if India is going to reach there in just two more decades, it won't be a happy situation unless we are very comfortable with the digital world and the digitalization journey. And unless we are able to cover that journey with inclusion being a critical aspect of it, otherwise large parts of the country will simply have no part to play in it. And to talk about that, today we have a really high-powered panel. Not high-powered because of their designations, which are very nice, but high-powered because they've all spent 2 decades or more going deep into different facets of what this means. And I'll quickly run through uh, who they are and what they do and why are they here today, right? So let me start with Chetan. Chetan Kapoor's the CEO of the Tech Mahindra Foundation, but more importantly, has been an entrepreneur, a business leader, a foundation leader, and has worn many hats over 2 decades of understanding how education, skilling, and employability work together. And why focusing on one is never going to be adequate till you can focus in all of them. Otherwise, the outcomes will never be what they were intended to be. He's also somebody who's very close to the concept of inclusion. In fact, is the brains behind and the hands behind the Ability Network, a network that the foundation has recently started to focus on inclusion for people with disabilities, and is pretty much the only industry-wide platform that exists today to be able to do that. So welcome, Chetan, and thank you for joining in.
Thank you so much, Sumit. Thank you for that very generous introduction.
I'll move on to Rima. Rima is an educationist at heart. I think whatever introduction I might give, it will be incomplete till we start from where her entire history comes from. A teacher, somebody who's designed curriculums, designed programs, designed pedagogies, gone deep into how education actually works on the ground, and now runs one of India's largest corporate foundations, which is the NSE Foundation, which works across a very wide range of sectors, not just education, but many sectors that are focused on marginalized communities. So thank you for joining us, Rima. Inclusion is something that you've dealt with all your life, and we would love to hear more about that.
Great, Sumit. Thank you. Glad to be here.
Thank you. Moving on to Osama. Uh, I think the first time I read about you, Osama, is when I came across the term information poverty. And for 22 years, Empowerment Foundation has actually been working on the whole concept of how digitalization is not inclusive by nature. It can be as exclusive as it wants to be, and it can leave large populations behind unless action is taken. And I think there can't be a better topic than the one we are dealing with today, Osama, for you to actually help us understand why not everything is hunky dory with the world of tech, right? And it needs to probably take a closer look at some things that aren't working as well as they were supposed to. So welcome on the panel. I know you're on your way from the airport, so we'll come back to you in just a
Thank you
bit.
very much. Saluted for your, very loaded, responsible, responsibility-oriented, introduction. But great to be here, and thank you for organizing this panel to, get together. Yeah.
Thanks, Osama. And then we come to Prashant. If someone understands digital health, it is Prashant. I mean, I don't know if this word was around when you got on the health card journey, Prashant. And these are all terms that have probably appeared later, by when a lot of work had already happened, right? But as the founder of first health card and then 1MG, Prashant's had an absolute ringside view to how healthcare in India is getting more digital, and also therefore far more pervasive and impactful than it ever was. A part of the story that often gets missed in the middle of valuations and investors and everything else that's far more media friendly. But the ground reality of that is that digital platforms have really taken healthcare beyond what it could ever have gone otherwise. And we would love to hear that perspective from you, Prashant, as we dive in. That's a perspective that's missing, honestly, in the conversation in too many places.
Thanks, Sumit. Very happy to be here and appreciate the very generous introduction and look forward to the discussion.
Thank you. So, without further ado, let's dive in. And while we won't follow any great, template or format to this, I do want to get started by simply asking you all, when we think about India at 100, right? It's not even a topic that was in the conversation, let's say 5 years back, but now it certainly is front and center. When you think about this country reaching the milestone of 100 years, what's your vision of what digitalization and inclusion is going to look like at that point of time? What would you want it to be? And don't even think about how will we get there, but what would you like it to be at that point of time? And maybe we could start with Rima, and then we'll go across the room.
So for me, when I think of digitalization, I think, as you very rightly said, Sumit, it's about also inclusivity and inclusiveness. Uh, the huge issue that we have today is that India, as we know of it today, we have huge ends of the spectrum in every facet. If you look at the rich, we have the super rich. If you look at the poor, we have the the super poor. So we have these wide ends of the spectrum, which are not small, because even if we look at a 10%, we're talking about almost 15 crores. 15 crores of people is a huge, huge number. And if you look at geography, you have a place like Mumbai, which is so densely populated that you can't even stand in a local train without falling off. And you look at a place just down, like Palghar, or even a place like Nandurbar, which has such open spaces to get to one place to the other. It's so far in between. So when it comes to digitalization also, whereas you have the best software technologists from India, you have a huge cross section of people who only use it maybe for WhatsApp and for YouTube videos, and another, so essentially for entertainment, or maybe to some extent communication. And you have another set or subset of people who are very uncomfortable with technology. And here I would like to include the senior citizens, because we worked on the seniors. We have worked on seniors in the rural areas. And if we go by the UNFPA statistics of their research that they did, every 1 in 6 Indians is going to be a senior citizen by 2050. So that's going to be a huge number that we're going to grapple with. Now, these are people who are not able to physically able to use technology. So you're going to, they're not able to handle technology because of their hand, because of the of eyesight, of just because they are physically not able to use instruments and tools which can assist technology. They are not comfortable and they don't have the confidence. So I think really when I look at inclusivity, I'm looking at trying to encompass all these various sects and subsects and of people who are living in such dispersed geographies and across age groups, and get them to at least have some minimum level of awareness, access, understanding, and confidence. So I think if somebody is confident just using the basics, knowing how to transact, knowing how to access their records, knowing how to access their bank statements, I think we would have achieved a huge feat by then, because we're talking of DBT, we're talking of moving towards digitalization, but along with that we need to also create awareness, and we also need to create the tools that can help that awareness, access, and utilization.
Bang on, Rima, could not agree more. And I'm going to pick up this theme a little later. All too often, inclusion is easy to imagine when we think of the poor or when we think of people with disabilities, right? We don't always think of the elderly when we say inclusion. But the fact is that we are barreling towards a demographic profile where the elderly is going to be a significant part of the population, not something that we're prepared for yet. But I'll come back to that. Maybe I'll come to you, Prashant. What's your idea of what India should look like 22 years from now?
Yeah, as we turn 100, I think, see, if you look back at the growth phases of India and how we've been evolving so far, I think in the initial phase, for a very long time, um, just information and awareness was a differentiator. The haves and the have-nots were based on what awareness and what knowledge who is accumulated or has access to. Thereafter, infrastructure and physical access to all kinds of opportunities as well as enablers of opportunities. Some would have, whether it healthcare institution or any other infrastructure-based institution, that became the differentiator as to which part of the society would be more productive and which would not. Um, and I think with the digital age, at least there is a fair bit of democratization, um, both possible and in play, um, for bunch of aspects where now information as well as access is now a lot easier for a lot of people than it was before. And now we are entering the next phase where which is the age of AI, where even intelligence will be pervasive. So I think we are looking towards uh, uh, an or and we should aspire at least to move towards a situation where not only a small percentage of the haves are driving the progress of the economy and the country, but it's the entire uh, nation is able to participate. They are enabled to participate because they have the tools and resources wherever they may be located. So that is what is, I think, the magic of an inclusive uh, India of 2047 that at least I would be hoping we are able to get to. And if that happens, that from the smallest of towns, the biggest of innovations can happen, the biggest value creations start taking shape and getting scale, we'll be in a different trajectory.
Hang on, and I'm actually going to pick that theme up with Osama just as he comes back. Because you're right, right? From information, it went to infrastructure, now it's going to intelligence. And that's extreme democratization, but that's also coming with its own barriers to entry, right? To be able to access it and to be able to use it, even if you can access it. Uh, Chetan, what's your perspective on what India should be 2 decades from now?
You know, I'm tempted to quote Tagore because if you think about what he said almost 125 years ago, when he said, when the mind is without fear, you can find that there are certain lines from that poem of his which still resonate and which sort of hold true. Because while in the last 78 years, of course, we've done, phenomenally well in so many aspects. Each time that, we have a discussion around how much there is to be achieved, I remind the audience that look back in 1947, we had a literacy rate of barely about 15%. And the fact that we've now managed to cross 80% has to be considered a significant achievement because the population itself has grown so significantly, right? So it's not like we haven't, done too well. We have, but of course, lots of ground to cover. Especially just picking up on what Rima and Prashant just said, that the development that we seek for India uh, cannot be partial, but whole. So development, we would want to see an India that is wholly developed and not partially developed. We would also want to see an India that is developed in the truest sense, because we understand that development does not only mean better access to infrastructure. Development also means that our mindsets are geared to be more inclusive, that we look at inclusion not just through economic or technology lens, but most importantly through a social lens as well. So there's lots of ground to cover on all of these, and I would really want that by the time we hit the 2047 mark, and hopefully, I hope to be around to see that. Um, we would have been, we would talk about some of the challenges that we talk about today as a thing of the past.
Thank you, Chetan. Sama, coming back to you, right? So Prashant spoke about it, and Chetan referred to it too, right? Um, Cell phones was the last revolution, probably, that happened before AI came in now, right? Computing was the one before that. And as we go through this, I'm sure there are more to come in the next 20 years. But as all of this is happening, where is the lever of inclusion playing out? And how do you see that 20 years from now when India actually hits the 100 milestone? What is your vision of what India and inclusion in India should look like from a digital perspective at that point of time?
Uh, Okay, so while I work on all the positivity for including maximum number of people, two words that Rima mentioned that I want to start the story is she mentioned Nandurbar and Palghar. In both the places we work. In Nandurbar, there is a village which they don't reach their house without crossing on a boat by the river, and there is no connectivity. For connectivity, they have a small little danda pole on which there is a shack that they have created to fit the mobile. जैसे ही उसमें लगाते हैं थोड़ा सा डंडा उसमें काम करना शुरू करता है that start working and then they can talk and all that. That's after 75 years of independence. And there are several developmental tools of inclusion. You know, literacy is a tool of inclusion, technology is a tool of inclusion, communication is a tool of inclusion. In latest, mobile is a tool of inclusion, UPI is a tool of inclusion. But my question to myself and ourselves is that why the people who are left behind are the last people are always to be considered to be taken into consideration, and why are they constantly kept on excluding while we keep aspiring for new innovations, new technologies, new revolutions and all that. And because of that, I feel aspiration is the worst word for us, because it actually gives us in a very positive frame of mind that today we were two people included, tomorrow two people two plus included. So your graph is always increasing. So your aspiration is great. That 10% growth, 5% growth, 350 million mobile penetration in rural India, now 400 million, my 500 million, and all that. But the point is that when I start counting the people who don't have a smartphone, I start counting the people who can't do UPI, I start counting the people who have the connectivity but still can't have a meaningful connectivity to do transaction, and so on and so forth, is what bothers me, and therefore it also bothers me that again 25 years. Just because we say 100 years में क्या होने वाला है, I mean, rather say in 100 years who we should not leave behind, and in all the aspiration, and why we can live without having Sumit having a smartphone, but Sumit's sister in a village should not have a without a smartphone, or my fellow citizen, because that's the call of the revolution. No, every revolution comes out saying, "ये inclusive है, this is for poorest of the poor. It will make democratic. Everybody, वो सब एक ही लाइन में खड़े हो जाएंगे, सब एक ही जैसे होंगे, न जात न पात न पैसा न ये, सबके पास मोबाइल है, सब इक्वल हो जाएंगे." तो नहीं है ना इक्वल. द पॉइंट इज दैट वी आर नॉट इक्वल. They are asked people, our villages are asked and give you a more formidable answer to my argument is that according to the last year's data, 122 million people did online transaction from rural India. 122 million people did online transaction from rural India. Rural India's internet penetration is 445 million. Rural India's population is 910 million. Right? How many are 122 out of 900 million? Number one. Right? If I see online transaction or online payment is a parameter of meaningful connectivity, because then I can pay and buy and things and receive and get my even direct benefit in my account, and I can check and so on and so forth. But out of 122 million, only 6% of out 122 million people did 45% of all transactions. Which means what? Not even 10% people of rural India is able to have a meaningful access, digital access, to do their daily course of needs, not aspiration, needs. Because without Aadhaar authentication, you can't have food. Without having a proper access or connectivity, you can't have access to education. So all access to rights is based on access to digital, because of which we are bothered, and you are also bothered. And initially, you said that exclusion is become a very strong topic. So my aspiration and the answer to your question of what would I like to see in 100 years, I don't even want to wait 100 years. I want to see that in 100 days. Can we have everybody connected? Can we have everybody on the same, footfall in terms of having the access that we see is make us equitable? मैं अपने पसंद से गरीब रहूं कोई बात नहीं है, लेकिन आई शुड नॉट बी डिप्राइव्ड बिकॉज आई डोंट हैव कनेक्टिविटी. आई शुड नॉट बी डिप्राइव्ड बिकॉज आई डू नॉट हैव a smartphone, and so on and so forth. So that's my aspiration. Can I squeeze the time of reaching 100 years into 100 days or 100 weeks to make nobody is excluded because of the parameters which makes us equitable. That's actually what I would like to say. Thank you.
Much to think about, and some very, very hard-hitting statistics there, Osama. I did not ever knew about the 45% of transactions coming from 6 million people, right?
6% of
Of
122
the 12
million.
million.
Yeah. 122 million. Yeah.
Chetan, I'm going to pick up a related topic because, I mean, all of them are related, but still, right? So I want to go to the part that we all talk about a lot more in the public domain now, which is employability. We have a serious employability problem. Nobody denies that. For the longest time, I think it was McKinsey, some probably 20 years back, which came out with a report that said so much percent of our college graduates are not employable, right? And that was the most quoted number at that point of time. It's easily been 15 years since. Has anything much changed? And are we even moving in the right direction for it to change? Because employability is the end goal, but there are many things that go into it before that. Would love to hear your perspective on that.
Okay, are we moving in the right direction? It's like, asking captain of a ship who does not really have too many, does not have a compass and does not have too many guidings to, answer that question. So it's difficult to say, honestly. But from the perspective that I have built over the last, 15 years of watching this space, I definitely see that that a lot of course correction that was required in the area of employability enhancement for our country is now beginning to happen. And I would say that for a fairly long period, we did not really know how to go about it, and that McKinsey statistic that you're quoting, Sumit, this was back, I think, in 2009 or 10 when this study came out, which said that India has to skill some 500 million youth by 2022. Now we are already past that goal, right? But I don't think we are anywhere near that. Just 2 days ago, or probably yesterday, Times of India featured a story that of the people who have been part of a skilling program in India, only 15% have been able to get jobs, right? So clearly, now I think where we are missing the bus and where we really need to step up is to stop equating employability with employment, right? There's a lot which is packed in the word employability. And in fact, in the questions that were put to us, I noticed that it talked of job readiness and long-term employability. Now, if you think about these two terms, there is a bit of a contradiction. Okay, if I am job ready for tomorrow, does not mean that I have long-term employability, right? The gig economy has opened up a lot of job opportunities for our youngsters, but it does not mean that they are really employable in the true sense. So when we think of any sort of a skilling initiative, it has to be looked at from a short-term lens. Of course, we know that a lot of our youngsters, after completing 12 years of school, come out with such significant deficits that they need a quick short-term booster as far as employability skills are concerned. Also knowing that many of them are just waiting to, start earning, we need to have that short-term lens around skill development. But equally important is to have a longer-term lens, which is where the idea of employability really has to take root. And I would say the journey has to begin not from skilling but from schooling. We all understand, I do not have to talk about the importance of education in this context, but to keep education distance from the idea of skilling is, I think, a monumental mistake that we need to amend fast. Because when we have our kids in senior grades, grade 6, 7th, 8th, I think these are seminal years to start imparting the basics, the foundations of what it takes to be really employable in the true sense, right? And we are not talking about, just offering low hanging fruits to our youngsters. We are talking about helping them build their careers, with some kind of a pathway which you open up for them early on. So I think we need to really look at this through the whole employability conundrum has to be looked at through a much longer term lens. And while the new education policy does allude to the fact that we need to have vocational training at school, but I think a far more needs to be done in this regard. Because when I meet our youngsters who come into our smart centers, the skilling centers that we've been running for the past about 13 years now, I still see, and these are in all major cities of India. This is not even rural. I still find that youngsters who've completed 12 years of schooling and who come into our centers are often not even able to communicate, forget in English, not even in their first language. Such is the deficit in terms of, where they come from. If you also, for example, ask them to do a logical or a reasoning problem, a lot of them are not able to pass muster. Now, if you think about it, we've spent 12 years with them at school in which we've taught them a language, we've taught them some math. And still, if they're not able to, communicate or do logic, then we really have some, significant change that needs to be made, at that level. So I think that is what the focus really needs to be. We've done our experimentations of, offering several domain related courses. In fact, when we started the journey, most of the skill development programs used to have a lot of domain specific skills and very little in terms of foundational skills. I think we need to flip this a little bit. foundational skills are still very critical, which need to be imparted, because in the absence of those, you may get a job tomorrow, but down the line, when you have to really create a career for yourself, you will still be found wanting. So that would be what I would want to put forth at this point.
Thank you, Chetan. And Rima, now you take that context and you think about what that means for women, right? End of the day, education, employment, livelihoods, all of this is a pathway to economic empowerment and having much greater agency when it comes to being able to make those choices for yourself. You've worked with women as a space and as a cohort by itself for the longest time. How does this entire move towards digitalization actually impact women, and are they being excluded or being adversely hurt far more, or are they actually able to ride this wave as well as the men are? And we are talking especially low income communities.
No, it's very funny that somewhere I think the entry points of this digitization and understanding technology and being familiar with technology, uh, it doesn't have any barriers, so gender sort of barriers don't apply there. Across our programs, and it was very strange that we thought COVID, at the time of COVID, how are we going to reach out to the communities, and hundreds of field workers, field staff, and we have the Shikshan Mitras. So, uh, for every sector, for every core focus area that we were working in, we had this concept of having a Saki or a mentor. We realized that in communities, it's not enough just to introduce something, but people need to be handheld, especially when you're talking about those who are really marginalized. You're talking about tribal areas, you're talking about rural hinterlands. Just having information dissemination, knowledge, or doing some community related work isn't going to help. You need that intermediary, you need that person who goes there, handholds. So we had this large cohort of field workers who themselves were from those communities. And we were wondering, how are we going to reach out? Many of them are women. I think almost 95% of our team at the field level were women. And lo and behold, what happened was they adapted so easily to Zoom calls and WhatsApp groups, and the transformation happened actually in about 2 3 months, and that was the most surprising thing. We were able to get on calls, we were able to communicate and do all that. So I think, to my mind, the entry level aspects of technology are not barriers, and women very easily adapt. But as I said, the hand holding would be required for communities. And that would form an integral part of how someone accepts technology, is comfortable with technology, learns about technology, and embraces technology. And when it comes to women, I think what it really did, and which we saw in many of our projects and over that entire period of COVID, which actually was not too far away, but I really like to think of things like pre-COVID and post-COVID eras, and post-COVID is not really that far away. If you look at 2022 and we are just in 2025, I mean, it's not ages or decades far back that we need to recall. And women really felt empowered with the phone. So it was not only awareness of how to use that technology, it was access to so many things. And if you also notice, Sumit, that post COVID, the information on the available to people who are able to access that with technology has just boomed. There are so many things that people can access today if they want to. There are courses, they can do certifications, they can, if they're agriculturists, they can learn about agriculture, about pesticides. If they want to access something in school education, there are enough free sources for school education, and it just goes on and on. So the volume of stuff that is out there has absolutely just disproportionately increased. And so that huge knowledge pool is available for people if they want to use it. But as with all pools, it's so vast that it would need somebody to help a person navigate so that they're able to get to what they really can use. I think health and hygiene, understanding their about themselves, their bodies, their a lot of things are what women have really learned from their use of technology. That has been something that's what we have seen. Also amongst our own cadres, when we look at how we transferred their salaries, they were comfortable. They have accessed their money. That's empowered them. A lot of these girls initially were not able to come out of their homes to work, and after much persuasion, we got them to work with us in these community level jobs. And then their salary would be utilized for the family. Now, here you have a situation where you're forced to ensure that everything is transferred to the bank that is in their name, and then they have access to their own money. So, that level of empowerment, really, I like to call it the ACE model, where you have awareness, you have access, you have control, and you have emancipation with empowerment. I think this was the sort of a level, or this was a shift that we saw in women, and they were very comfortable with technology. But having said that, today when I look back, I feel COVID was in itself a disruptor, and this use and access to technology was itself a disruptor for all these communities that we work with at the grassroots. Now comes artificial intelligence, and it'll be interesting to see how that's going to again disrupt. So the jobs that people traditionally thought that they could go to, at the entry level, foundational level, a small job where somebody wants to work, somebody wants to earn something, or it could be some entrepreneurship. It could be little jobs that they do at the side to earn. So it's more like sort of being independent financially. Now these are going to go through huge disruptions, and it'll be interesting to see how it pans out. I'm sure Chetan, Prashant, and Osama will know what happens on the field, and what it's really going to do to people at that level when they are looking the next 5 years. Somebody who was about 18 or 20 saying, "Okay, next 5 years, I'm going to do this and I'm going to work this way," and then we have artificial intelligence, which has now come on the scene. Now, how that's going to pan out is something which will be interesting to follow. Last but not least, of course, this may be more for the ground plus one level up, the people within our programs, where we did find people wanting to talk to, people wanting assistance in, I don't want to say mental health issues because that's really one end of the spectrum, but really when they are depressed, when they want to confide, where they want to talk to. I now increasingly find people turning to artificial intelligence to be that friend, and which is surprising. So again, how these things are going to work, and whether such counseling and other things, whether that can be done through artificial intelligence. This is something which we worked with, and therefore I brought it up. How relevant mental health modules are going to be worked into community level programs, or whether something like this, AI disruptor can take care of it, especially when it comes to women, would be interesting to see.
Great. No, thank you for sharing that perspective, Rima. I'm going to jump from there to healthcare. And Prashant, the reality of India today when it comes to healthcare is that physical infrastructure has its limits, both in terms of reach and capacity. Uh, Digital healthcare, I mean, sure AI, but many steps before that as well. Give us the scope to customize, give us the scope to extend that reach, give us the scope to do a lot of things that physical infrastructure necessarily cannot. How do you see that playing out? And especially, I mean, I would love to hear the overall perspective, but I would love it if you can also add in how does that play out at the bottom of the pyramid?
Sure. Firstly, just to be clear, in healthcare, there's a certain part of it which requires physical infrastructure. Digital is not the solution for everything. Um, but I think what we are seeing right now, and what is more and more uh, important as we grow, healthcare access in what we are seeing tier 3, 4, and beyond um, is actually more expensive and more complicated than it is in the metros. So unless um, if government hospitals, government infrastructure, unfortunately, is already in a situation where um, hardly the quality and the capacity both are stretched beyond the limit. So a lot of people who come from small towns and villages, when they come to the city, it's a massive challenge. That dealing with health itself is a challenge, but dealing with the system of healthcare is a bigger challenge. Just trying to figure out where to go. There are numerous touts in this entire ecosystem trying to take advantage. There are all kinds of players. So just getting access to information and knowledge as to what is out there, what is right, what is not, it has been a challenge. And when we see a lot of consumers from these parts of the country, and when they want, after they go up from their treatment, again, they need to set up an logistics model where somebody is sending them stuff from the city because those medicines or equipment or whatever they need to maintain their uh, post operative healthcare is also not available. So now those are the areas where there is a tremendous opportunity to make a difference, and that's being felt already. People know that okay, this is the right price, these are the right things. And people are aware because when there is a need, they do go and try and figure it out. The other part, of course, is um, where I think there's still not um, enough progress is around telemedicine. I think there is an opportunity, but um, it's been one of those areas where both the government and the industry has to do a lot more to make it workable. And technology plays a big role because right now the complications or the challenges is around these things. What today an AI platform can do, what which was probably not possible till a year back, was that a patient can talk in whichever native language and he or she wants to talk, and the doctor sitting on the other side can actually get a fully translated English version of the same and can respond in English, and that can get communicated in the native language again, happening almost real time. So that is where technology is going. So a lot of the communication barriers and all are breaking down. Uh, how fast will those uh, programs kind of take off? And the second, the big important part of healthcare also is um, the affordability part of it, and who is um, going to be the provider and who's going to be the payer. So I think the government actually is looking at with Ayushman Bharat moving beyond being a provider into an enabler and payer of healthcare. And if that is also opened to preventative healthcare and outpatient healthcare and telemedicine, where patients can go to any platform of the choice. If the patient wants to um, talk to a doctor either at a platform like ours or in Apollo or Medanta or Fortis, they can do that and the reimbursement comes through the government channels, then I think it's a significant unlock for people to access the high quality healthcare while the affordability for them is maintained. So now that's the direction the system is moving to. We always hope it and wish it will go faster, but I do feel that once more and more consumers are able to just um, see the benefit of use cases where digitally they can access information, digitally they can access healthcare professionals, digitally they can access products and services, then it'll make life a lot easier, because for them, otherwise the access cost is just way too high. Going to a city, the logistics of it, living in a city, dealing with a city, all of that is hard. They might still have to do it, but streamlining all of that is much needed. So we are seeing a surge in domestic medical tourism. We are seeing a surge in, at least on our platform, transactions that come from tier two, three, and four. So clearly there's a need. Now, I would honestly admit our platform is not fully designed to cater to uh, and that's where a lot of work needs to be done by all kinds of technology startups, because they are designed for the internet, the type first kind of a world, where the tier 3 tier 4 is voice first kind of a world. And systems will evolve, systems will learn, but the market is brewing, and it is something that I think uh, will present a decent opportunity in the coming phase, as long as we are able to get the payer part of it sorted, which I believe the government has a role to play.
Thank you, Prashant. And that's the perfect point to bring you in, Osama. Uh, you spoke about how exclusion happens, but my question is the other way around. How does it get avoided? What does rural India or what does bottom of the pyramid India need from technology so that it's not left behind? It can come along on that journey. We may not be able to eliminate it,
Okay.
perhaps, but how do we minimize exclusion?
Yeah, I just wanted to show this screen that we are just releasing this book. I'm in Hyderabad tomorrow about digital health in India. When Prashant was talking about, and just to put one or two line there before I reply to your question, is that a lot of health solution is dependent, or huge percentage of it based on information, just information and consultation, and that is available, that can be made available on digital infrastructure without covering the distance, physical distance. But even that we have not been able to prioritize to make the consumers reach the health solution, which is almost considered to be preventive health, is based on information and consultation and yeah, and guidance and all those things, which is 85% of the health issues. But having said that, the reason I wanted to put that is that that is purely based on digital infrastructure to make it available to the consumers, and not only curative health solution. Coming back to that, how do we minimize the exclusion? Is purely by concentrating on creating digital public infrastructure much more pervasive, adaptable, and contextualized. I will give you one example. For example, the whole world thinks that only telcos will solve the problem of last mile connectivity, which is actually not true, because if you are dependent on them, they will always be going on the ARPU, unless there is a revenue model, they won't connect and the entire rural India will be left, and it is left behind. They are only going there when now finally it is proven that data is more important than connectivity. Right. So ultimately, considering the whole exclusion, I mean, what we want those who want to connect, those whom we want to reach. Actually, उनके पास भी हम इसलिए जाना चाहते हैं क्योंकि हमें उनकी जरूरत है, उनकी जरूरत को पूरा करने के लिए हम नहीं जाना चाह रहे हैं. Like, we want employability for our company by them. Therefore, we want them to be digitally skilled so that they can work for us. We don't want them to be digitally skilled so that they can do transaction better. We don't want them to be digitally skilled because they can adapt better education without meeting the teacher. Right? Look at all the edtechs. They're not teaching them to make them great human beings with digital tools. They want them to be, digitally equipped to serve them or some employer. So वो mindset ही नहीं है. The point is that, and therefore, when I want to know that, when I'm bothered that I need to reach to the people with digital infrastructure so that they can solve their problem. They can reach food, they can reach education, they can reach entitlement, they can reach this. Then you will see that, oh, okay. Then to फिर 9.6 kbps is also fine. Then to, with low connectivity is also fine, or low bandwidth is also fine, or cheap machine is also fine, or something like that, right? We don't even know, like health का भी मैंने example दिया. No doctor goes to public health center or community health center. And then we keep on talking digital health. Digital health is a bad word. It is not digital health. It's the same health with digital. Digital health क्यों हम बोल रहे हैं उसको? डिजिटल का कोई हेल्थ थोड़ी है. डिजिटल का हेल्थ तो खराब है जब it can't reach to the people who need it. So, the point is, we are not appropriating the technology or innovation to suit the local people. For example, we were talking about language. हमारा experience बोल रहा, we are in 2,400 locations. And none of the places we use the curriculum in English to the English curriculum to local language to make them digitally skilled. No, we did not even use any curriculum. They all learned through peer learning. They appropriated the keyword also, figured it out immediately in another 2-3 days कि ये keyword में क्या आता है, कैसे आता है, and all that. It's not difficult, actually. And technology is oral. Our language is also oral. So you don't even need translation, and all that is not required. So, there is a lot of things like we did last mile connectivity. Last mile connectivity is not subject to only thing. हम बैम्बू का भी पोल बना सकते हैं वाईफाई क्रिएट करने के लिए, किसी के घर पे भी एंटीना लगा सकते हैं उसको कनेक्ट करने के लिए. So, there are so many things. Like I also said that if my information need can be solved by a brick and mortar phone, why do we need a digital phone? So all the problems cannot be solved only by having the best bandwidth, the highest bandwidth, the most beautiful machines, the AC, the air conditioning rooms, and the battery backup and all that. People will say, वहाँ इलेक्ट्रिसिटी नहीं है तो कंप्यूटर कैसे चलेगा? अरे बैटरी से चलेगा. अच्छा, बैटरी से तो 4 ही घंटा चलेगा. तो आप कितने घंटे यूज करते हो भाई? आप भी तो 2 ही घंटे यूज करते हो 24 घंटे में, या 4 घंटे. तो उसको क्यों दे रहे हो आप 24 घंटे? So, there's so many, so this is because we think that we can only solve the problems, and we don't even identify the real problem of the people. We are actually solving problem of ours. So what I'm actually, the short answer is that there is an appropriation of technology and innovation can be frugalized, contextualized as per the need of the people and not mine, to make it reach faster than later.
Thank you. Thank you, Osama. Very, very aptly said. Thank you. I did have a whole bunch of other questions that I thought, and of course, we are out of time. So I think we've been a successful panel, right? If you run out of time, that's a good sign, as compared to finishing much earlier. But no, so I won't go through the rest of the questions because we're really at the end of our time period here. And I know it's customary to try and summarize what everybody said, but that would be, I think, a great dishonor to everything that you said, because they were very, very disparate themes and they were very, very distinct messages in what all of you spoke about. But my personal takeaway is very simply that it's a large country. If it's going to be 100 years old with 140 million people, 140 crore people, 90 crore in the villages, then business as usual digitalization will not work. And if markets are not creating it, then there are alternative incentives that have to come into play for that very, very large market to be addressed. Market is not just an economic market, it's also a social market, right? So, from that perspective. But thank you all for your time. Thank you for sharing your thoughts so candidly. And thank you for being here today. It was a lovely conversation.
Thank you very much. And it was really,
Yeah,
really
absolutely.
engaging.
Thank you.
Enjoyed hearing everyone. Yeah.
Thank you, Sumit. Thanks to the India at 100 team at CII for hosting this. I think and this is a dialogue that obviously needs to continue. So
Yeah. Yeah.
thank you. Thank you so much.
So thank you, Aparna, for putting us all together.
Thank you so much. Thank you, Sumit. Thank you to all our panelists. And at India 100, we'll continue to engaging with you in future initiatives. Thank you so much.
Thank you.
Thank
Thank
you.
you.
Thank you.
See you all
Bye-bye.
soon. Bye bye.